4 persons in 10 prostate gland carcinoma cases in the UK are undiagnosed deceased, a research suggests. The paper found 1 in 4 persons' cases of prostate gland carcinoma was undiagnosed in ONENE. In an aging people, the Mercy has named for immediate activity to hinder a tick period bombshell in regulation of prostate gland carcinoma regulation. Orchid head execution Rebecca Gateway told, in prostate gland carcinoma due to be the largest prevailing carcinoma in the UK during the following 12-year, we are cladding a capacity meltdown in regulation of diagnosis, treat and patient thoroughness. Immediate activity is necessary to be undertaken currently. The paper canvassed the view of the UK's guideline prostate gland carcinoma expert and looked at previous published information to get an image of the prostate gland carcinoma thoroughness through the UK. The information came of organisations such as NHS England, charities and the Domestic Prostate Gland Carcinoma Auditing. The paper says how 42% of prostate gland carcinoma patients saw their GP in symptoms 2 times or more than up they were called, in 6% seen 5 or more than times preliminary to direction. Professor Frank Chingwando, a urology general surgeon at Barts Public Health NHS Confidence told, 25% of prostate gland carcinoma cases in the UK are undiagnosed at an progressive phase. That compares to fair 8% in the US. Wherever down there is more social knowledge of prostate gland carcinoma and more screen, he added. He told Time down there was debate about the efficiency of the norm PSA testing utilized to discover the carcinoma. It is yet urgent how patients are undiagnosed previous to evaluate if they requirement treat or not, as progressive prostate gland carcinoma is untreatable. The paper as well told down there necessary to be renovated efforts to evolve superior test methods. The PSA testing is accessible complimentary to any man elderly 50 or above who customer request it, but the paper told the can build injustice in tests creature undertaken up by more than very educated men in more than rich areas. Professor Anne Mackey, CEO of programs for the UK Domestic Screen Board, told the testing was not proposed everywhere since it was not really nice at predictive that men include carcinoma. It will miss several type of cancer, and frequently such type of cancer how are selected up while with the PSA testing are not detrimental, she explainable. Treat for prostate gland carcinoma can reason unpleasant party effects, so we requirement to be certainly we are treat the lawmen and the law type of cancer down there is a lot of study in screen and treat for prostate gland carcinoma, and the board, on in Pleasant and the NHS, is compliance a shut eye on the testimony as it develops, she added. A representative for NHS England told, NHS England is work close in guideline clinic expert to give the newest study on prostate gland carcinoma in experience. AIM job is as well creature taken to provide prostate gland carcinoma is undiagnosed rapidly and how all receives the top thoroughness where they dwell through the nation.